Brain health is crucial to our patients' long-term health and independence. We know this. But in our busy days, it can be hard to find the time to talk to patients about their memory or thinking. The GSA KAER Toolkit for Brain Health, developed by the Gerontological Society of America, gives us structured, practical ways to address brain health and cognitive change. There are 4 steps: KICKSTART, assess, evaluate, and refer. Let's focus on the first step, KICKSTART.
We're doing so many different things for our patients that oftentimes we don't have time to address memory concerns.
Here's how you can apply KICKSTART in your own practice. During annual wellness visits or regular check-ins, include a question or two like, have you noticed any change in your memory or thinking? Has anyone close to you mentioned that you seem a little bit more forgetful than usual? How confident do you feel managing your medications or finances these days?
I think if someone wants to add memory screenings routinely into their clinic flow, you could start with something as simple as just having a question you ask every time. Do you have concerns about your memory, or do other people have concerns?
I saw my GP every year. I had an annual checkup, but we never really tested for any cognitive issues whatsoever.
If a primary care physician just asks the question, do you have any concerns about your brain health?
I would tell a doctor to ask the question. Ask your patients. It's a gift you're giving them, an opportunity to speak something that's probably in the back of their mind if there's an issue.
These questions aren't diagnostic tools, they're just conversation starters. They let your patients know that it's safe and appropriate to talk about cognitive changes without fear or shame. If their answer is no, I haven't noticed anything, you've still planted a seed. You've let your patient know that you are paying attention to their brain health, that it's part of your care, and that they can bring it up later if something changes. You can also normalize the conversation by framing it as part of healthy aging. Say something like, as we age, it's normal to keep an eye on how our brain's doing, just like how we watch our joints, our eyes, or our heart.
It's destigmatizing to say, I bring this up for every person every year. This is just a part of our functioning in health. I just want to ask how things are going.
And the more that we bring it up and the more that we normalize it, it can take a lot of stigma away.
Most people, not just people living with dementia, get their health care at primary care. It's like the front door to the whole healthcare system. And so people often have their earliest symptoms, and it's their primary care provider who recognizes those.
Normalizing those conversations about brain health are really critical in providing the best possible care.
I think it would have made a huge difference if my father's primary care doctor brought up his memory issues, because it's his doctor. So he trusts him, he takes it more seriously. I'm his daughter. It's a different relationship. It's not the same.
Over time, when patients hear the message consistently, it reduces stigma. It builds trust. And it increases the chances that they'll speak up when something's off. Even it makes it easier for us to have important conversations about brain health habits that can help people of all ages, as well as opportunities to promote brain health and dementia risk reduction. Conversations we should all definitely be having with the patients we serve.
I think a primary care provider should concentrate on not only your physical well-being, but also your neurological well-being as well. Your heart is important, your lungs are important, your intestines are important, but your brain, your memory, your cognitive function is just as important.
We talk about heart disease, we talk about kidney disease, and yet it's like such a novel concept.
I think if my GP had given me regular memory tests, I would have probably found out earlier.
The GSA KAER Toolkit for Brain Health offers you a roadmap for the gold standard to getting your patients evaluated and referred to specialists in a shorter time than what you would see in the real world today, which is way too much delay.
So I think it's a really helpful framework for any physician that doesn't know where to start to initiate these conversations.
So that's KICKSTART, a small shift that opens the door to earlier detection, better planning, and better outcomes. And it all starts with a simple question. You can learn more about the KICKSTART step and the entire GSA KAER Toolkit for Brain Health at carebrain.org. Thanks for making time to kickstart those conversations. Your patients' long-term outcomes will benefit from it.